Hypertension is a major global health threat due to its high prevalence and detrimental impact on cardiovascular disease. Dietary factors play an essential role in maintaining cardiovascular health. However, the effect of macronutrient intake, particularly proteins, that contribute to the prevention of nitrogen and physical functions on hypertension remains controversial. In this study, we investigated the effect of relative protein intake on hypertension and the mediating roles of physical fitness and circulating fatty acids by using the Mendelian randomization study. To date, there are several uncertainties remain with regard to the relationship between protein intake and hypertension, which limits the understanding of the etiology of hypertension and the preventive targets for hypertension. For example, first, the recent evidence for the association between protein intake and hypertension primarily stems from observational studies and short-term RCTs, and it is unknown whether the association is causal and independent of other macronutrients. Second, currently there is a lack of research systematically elucidating the causality between protein intake-related metabolomic signatures and hypertension. Thirdly, since protein intake influences physical functions closely related to hypertension, the mediating roles of common cardiometabolic factors in the association pathway could inform promising targets for reducing hypertension risk in individuals with protein malnutrition. However, such evidence is scarce. Therefore, to fill these knowledge gaps, in this study, we aimed to assess the bidirectional, independent causal associations of relative protein intake with hypertension and blood pressure, to explore the causal associations of metabolomic signatures associated with plant protein intake or animal protein intake with hypertension and blood pressures. And finally, to identify the mediators and to quantify their mediation proportions in the causal association between relative protein intake and hypertension. This figure shows the univariable and multivariable Mendelian randomization estimates for the causal associations of relative protein intake with hypertension. And we can see that a higher relative protein intake manifested a causal protective effect on hypertension, independent of the effects of other macronutrients. This figure shows the univariable Mendelian randomization estimates for the associations of relative protein intake with blood pressures. And different from carbohydrate and fat intake, higher relative protein intake was causally associated with lower levels of pulse pressure in a unidirectional pattern. This figure shows the univariable Mendelian randomization estimates for the causal associations of metabolomic signatures associated with plant protein or animal protein intake with hypertension and blood pressure. And we can see that the plant protein-related metabolites such as glycine was associated with lower risk of hypertension and lower levels of pulse pressure and systolic blood pressure. In contrast, animal protein-related metabolites including leucine, isoleucine, and valine were associated with higher risk of hypertension and higher levels of pulse pressure and systolic blood pressure. This is the selection process and the mediation proportions of each mediator in the causal association between relative protein intake and hypertension. In panel B, we can see that the lower levels of the frailty index, which had the highest mediation proportion of about 40%, and MUFA and SFA, as well as higher levels of grip strength, standing height, and sitting height, mediated the causal effect of higher relative protein intake on lower hypertension risk. In summary, this study sheds light on the importance of incorporating adequate protein intake, distinguishing plant and animal sources in dietary recommendations for hypertension protection, and reveals promising targets for reducing hypertension risk in individuals with protein malnutrition. These findings enhance the understanding of the pathogenesis of hypertension and provide novel insights into targeted prevention and intervention. Thank you.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.